The Integritas Institute has been in existence here on campus for about 8 years. We are part of the Catholic Campus Ministry, the Newman Center, and our hope is to provide opportunities for the students in the professional schools at the university. Certainly the College of Nursing, but also the College of Medicine and the College of Business Administration and various other schools as well, to give the students an opportunity to look at the broader dimensions of their professional practice or their future professional practice. Today we are delighted to have Louise Simonson. Joyce?
It's okay, Bob. Go right ahead.
All right.
Hi, Joyce.
Louise is a nurse practitioner. All the successive stages of her nursing education have been performed here at the University of Illinois at Chicago, so we can consider her homegrown talent. And Louise is now the administrator of the Perinatal Center at the University of Illinois Medical Center. So she's talking today about cord blood and its uses. So, Louise, we welcome you.
Thank you. Can you all hear me? Yeah. All right. Well, first of all, I want to thank you all for inviting me to present today. And I want to tell you I'm very impressed. You all must feel brain dead right now if you've been in back-to-back classes. And the fact that you've even come here in your lunch hour is a very impressive thing. So thank you. I want to give you a little background as to how I became involved, if you will, with our topic today, which is cord blood donations. As Bob Casey said, I'm the administrator of the UIC Perinatal Center. And some of you in your professional life will work in OB, you'll find out that in Illinois, there are 10 administrative centers throughout the state. The University of Illinois is one of them. And we have a group of hospitals that we're responsible for. In the case of the University of Illinois, we're responsible for a total of 15 hospitals. And our region actually goes from Lake Michigan as far west to the Fox River, as far north as Plains, and as far south as Olympia Fields. And as I was saying, can I use the mic? Can people hear me? You can hear me? All right, I'll use the mic. Can you hear me now?
Yes.
All right.
Good.
How I became interested in this whole topic was that in 2004, there was actually a law that was passed, and I'll show you the law in just a little bit. But it became part of the Hospital Licensing Act. And it said that all licensed hospitals shall offer a pregnant woman the option to donate to a publicly accessible certified cord blood bank. So as part of the education for all our hospitals, I felt it was important to find out all I could about this program. So that's the background. How many of you are working in OB right now? Actually, quite a few. All right. Those of us that have worked in the area know that cords and cord blood are something that we just look at as, well, something that you could throw out. But we're really missing a tremendous opportunity. And so I think the slides will speak for themselves, but cord bloods, as well as bone marrow, have a tremendous number of stem cells. And as you can see from the blood stem cells, they can form then into RBCs, WBCs, or platelets. One thing that's so interesting about cord blood, well, it's abundant, but it is a non-controversial source of stem cells. We're not talking about interrupting any pregnancies or anything else. It's the cord blood that would normally be thrown away. Why cord blood is actually a wonderful source of stem cells is that if you compare it to bone marrow, it actually has 10 times the concentration. So it is extremely rich in stem cells. How is cord blood and bone marrow stem cells used? Well, there's a variety of areas that it can be used. One are hematologic cancers. I think you can see that. Leukemias, lymphomas. It can be used for genetic diseases, sickle cell, thalassemias, errors of some, and it rests for bone marrow ablation. So types of adult treatment. But this is really these other four we use where the cord blood stem cells are used. Well, this is a quote, actually, from a Joan Kurtzberg, who's the director of the pediatric bone marrow transplant program at Duke. And according to Dr. Kurtzberg, only 60 to 120 cc's of cord blood contain over 900 million stem cells, enough to totally reconstitute the bone marrow of a sick child. I think this is actually a kind of an overwhelming figure when you look at it. The question has come up, who are actually the recipients of cord blood donations? And so there was the National Donor Program, Marrow Donor Program, has actually kept kind of a statistic of this. And you can see that the largest group of patients that are getting the donations are in the ages of 5 to 14, which some people may have thought of actually being a little bit older. They may have thought that it just goes for babies. The next group, as you can see, is under 5, and then the numbers kind of are lower for other ages. One of the reasons that it's probably not used quite as much for an older adult is the amount of stem cells and cord blood that we actually need. But in the 5 to 14-year-old group, it's definitely been used. Well, what are the advantages? There's a lot of advantages versus bone marrow. One, it's available. It's abundant. With every birth, there's the possibility of somebody donating cord. It can be stored, and as it's stored, it's actually it's frozen, and it can. I'm trying to remember the number of years, but I think it was 5 to 10 years. It might even be longer. I have to double check that figure. And there is no cost on a donor program. There's no risk to the donor. With bone marrow, the donor has to expect a lot of pain, the possibility of infection. With cord blood, this is something that there is no pain involved, and it's something that would be thrown away. Why else is it good? Well, you can see it's less risky to the recipient. One, a baby, most babies haven't been exposed to viruses. Now, this is something that we'll check the blood for, but it really decreases the number of infections that might be inherent in the blood itself. And there's less graft versus host disease, like mismatches. So for many, many reasons, it's a very good source. What are the disadvantages? Now, even though we have to list these, I don't think, in my mind, I think that this was many disadvantages. One nation, I think that speaks for itself. If you're using cord blood, it's on an average 60 to 120 days. It may take longer for the engraftment time. And then lastly, and this is rare, but there is the possibility of the transmission of undiagnosed genetic disease. Well, you might think, well, has this just recently occurred? I mean, I never heard of this. But actually, it's kind of interesting as I was reading up on it. Europe and England was way ahead of us. They actually started the first cord blood transfusion in 1972. And the thought of having the program, as you can see, started in the early 70s. It took us almost 30 years later, 29 years later, before we really got into this. And one of the groups, you'll see the initials ITMCS. It stands for the Institute for Transfusion Medicine Clinical Services. And they have actually started 13 cord blood banks as of April 2004. And in the Chicago area, there is a cord blood bank that's located in Glenview, Illinois. And as of last year, I didn't call them this year, but as of last year, they had over 5,000 cord blood donations. Well, one of the real issues when you start looking at donations of any kind this is very interesting to me, whether it's adult blood or cord blood. Traditionally, minority populations do not donate at the same level as the white populations. This was the experience in England, and even when I talked to the head of our blood UIC, they said more or less the same thing. So this becomes our challenge. And it became the challenge of the National Morrow Donor Program. And the goal of this group is to increase minority donations from Black, Latino, Asian, Pacific, and Pacific Islanders. Now, as nurses, you will be considered the resident experts in everything, whether you know anything about it or not. And I think that this next point is very important as you have people ask you about cord blood donations. Because families may be faced with the thought, should we do private cord blood donation versus public? So I want to spend a little time talking about this. From everything I've read, I think the public way is the way to go. And the American Academy of Pediatrics feels the same way. Let's look at the private banking. The costs are very high. In other words, you would collect the blood, your cord blood for the baby, and if you do it in a private bank, the first year, just to get the blood in the bank, would cost about $1,700. You'll see different prices. You'll see different places advertising on the web, special, $1,500, whatever. But it represents a high amount of money. And then after the second year and above, every year that you keep that blood in that private bank, there is an add-on charge of $100 to $200 a year currently. Who knows? That price may be subject to increase. The other major thing to think about is usefulness. If you say you own baby's blood, as you can see, just a very, very small percentage of private samples are actually used by the families later on. Genetic problems. Let's say the baby has a genetic problem. Well, you can't very well use its own blood to correct an inborn error. And let's say that the child develops leukemia at a later age. Well, the stem cells probably contain leukemic cells. So there's many reasons that private banking may not be the panacea that people may think that it actually is. But the idea is to have a large public cord banking system where families can voluntarily donate the cord blood, and it gives a source for underrepresented populations, as we have talked about in the past. What actually happens, I'm probably getting ahead of myself, but every sample of blood that comes into these cord blood banks that is tested for safety, both from infections and genetic problems, etc., is registered. And the idea is, if somebody in, let's say, Oklahoma, there's a child in Oklahoma that needs stem cells, they will go into the registry and look for those matches that are closest to that child, and those stem cells or that cord blood can be sent to them. This was the Hospital Licensing Act I was telling you about. You may or may not be able to read it from way back, but I'll read it to you. It actually has about 4 major sections to this act. And I guess this is our legislators were also convinced that this was a very worthwhile program to go ahead and make it part of the Illinois Hospital Licensing Act. But it says that all licensed hospitals shall offer a pregnant woman the option to donate to a publicly accessible certified cord blood bank. In a way, I find this interesting, though, because this is hospitals. This has to come early. This has to come during the prenatal period. So it really has to be providers that offer this. Now, many hospitals do have clinics, such as the University of Illinois, where we provide a lot of care institutions do as well. In that way, this would be very applicable to us. But if you have private hospitals, the provider there has to be educated. Includes that there are no expense to the patient, to the hospital, or for storage. And I think this is also a very important aspect. These cord blood banks are actually help sponsor through grants, through the, the Transfusion Medicine, Institute for Transfusion Medicine, in order to keep the upkeep of storing this. But the cost would not be to the person donated. The blood you don't have to collect cord blood if it will threaten the life of the mother or baby. I can't imagine how it could because of the way in which it's done. And then lastly, it's sensitive to this. If a hospital employee, whether it's a medicine, an MD or a nurse affiliated with a bona fide religious denomination which holds belief that transfusion of blood is not moral, then they are not held responsible for being in the collection process. Now, let's look at the logistics of the collection. And as I was talking to Bob Casey ahead of time, I think one of the things that becomes kind of apparent to me why we may have problems with minorities donating is that, number one, after the mother is informed of this ability to donate, she has to send for a packet. This is a big packet. Now, I will send these back so you can take a look at them. Up until last year, or even this year, I didn't have them in Spanish, only in English. So that's another problem. If you can't read what it says, it's called. But the mother must send for this packet to the family at least 35 weeks gestation, if not earlier. And in here, there is a very detailed health history that's required of the mother. It is to ensure as much safety as they can for the cord blood. The mother must also provide a blood sample to rule out any kind of infectious disease. And when she completes this and everything checks out okay, she actually will get a kit sent to her. And she's supposed to take with her to even the hospital. You can see that there's a lot of information that is also required, and they also take a couple of samples of mother's blood just to double check and test it. At delivery, the idea is after the cord is clamped and cut, to draw as much blood as you can out of the cord, which in general is to 150 cc's. In the event that you can't even get that money, that much blood, it would still be used. It could be used by researchers, they were saying. And at the cord blood bank, the blood then is tested, it's frozen, and it's entered into the registry. Now, for ease of collection, which is very interesting, what happens is when the blood is actually collected and everything is put in this back in this biohazard container, it actually just goes down to the blood bank. And the cord blood bank in Illinois is connected, or is right next door to Life Source. And so when they come and bring units of blood to a hospital, they can also then pick up the donated samples of cord blood and bring it back. So it's very efficient. I wanted to give you a little idea, too, and this is actually my last slide, on the eligibility, some of the basic requirements for a mother. Most banks require that the mother is at least 18 years old or older, but there are, I think, maybe two where she can be as young as 16. They will accept somebody with tattoos, but it has to be I should put they're not eligible if it's under 12 months. Over 12 months, they are eligible. Under 12 months, it's questionable eligibility. Skin and body piercing. I think that many of us, I'm sure that includes even pierced ears. They will look at the type of piercing on an individual basis, and that's up to the individual cord blood bank to decide. The mother has to be free of infections. Some of the most common ones we think of course, are HIV, hepatitis, recent malaria, But, others now are West Nile, things like that. So they would test the blood for all those things. How about diabetes? If the mother is an insulin-dependent diabetic, no. Then they really feel that that's too much of an obstacle to the donation. If she's been a gestational diabetic, there isn't a problem. Cancers. Localized cancers, if the mother has a history of localized cancers, that family can donate. And then lastly, if the mother herself had been an organ or a tissue recipient, then they're asking them also not to donate. So basically that does talk about the cord blood program here in Illinois and at some other states throughout the U.S. Any questions? Yeah.
Is the cord bank center in Glenview the only cord bank center in Illinois?
I don't know. I don't know if everybody heard the question. Is the center in Glenview the only one in Illinois? I know it is for Chicago. And I know that not everybody uses LifeSource either. And so it's easier for those hospitals that automatically use LifeSource to use this cord blood bank as well. So, but I'm not sure about other parts of the state. But certainly, in the one in Glenview is not just for Chicago, but I would call it Chicago Metropolitan, which includes a huge population. Mm-hmm.
And just operationally, in your experience, have the people that have been collecting it and getting the blood down in the bank, they found policies and procedures to make sure that they're getting it frozen, that they're keeping it the way it should before they're collected?
Well, first of all, as far as I know, it is. I think that you'll look at the questionnaire for the staff. One thing they don't want, they want it kept at room temperature after it's collected. But then after it gets to the bank itself is when the freezing process would take place. But I think all the way along, the idea is to be very careful each step. Because if somebody's a recipient, we want that blood to be as safe and as useful as possible. So,
If it's kept at room temperature, doesn't it clot?
I'm not sure. I know that they do have some, there's somebody going to answer
I
that.
work in OB, and I know that a lot of places have heparin
Yeah.
tubes. and-
You can take a look at this.
Okay, so the tube is not.
Yeah.
Okay, thank
Yeah.
you. Thanks.
Yeah.
If the mother had an organ or tissue, she's a recipient,
Mhm.
and she has a history of like disease or whatever, then how does that affect the cord blood?
Well, again, maybe they're worried about some kind of genetic problem that may not have shown up or maybe passed on. I think that it's just that additional level of precaution. Now, there's not going to be that many mothers that are going to be, recipients, but it is that extra level of caution. Mm-hmm.
Wondering how this gets initiated, because it's not widespread that I know of that you can go into the liver and it'd be a copper system.
I know.
Do they have to initiate it, or?
Well, I don't know if everybody heard the question, but it goes back to dissemination of knowledge. How do women know about it? I think that's one of the weakest parts of this law. It should be every healthcare provider, rather than every hospital, should be responsible for informing the patient. Joyce? One of the issues is not as much as we need to. And one of the things was we were waiting for information to the Spanish-speaking patients as well. But I think it really takes a sell on the part of the healthcare provider when you look at all the paperwork that the patient has to fill out and to explain to the patient why it's important.
No, I think they should just have all the information in wherever women have prenatal
Right.
care. They should have those information
Right.
packets, and the woman can just sit there and fill it out while she's waiting for one of her
Right.
appointments. And they could even have
Yeah.
those kits, on the card in the OB units.
Well, the question came up, I agree with the information. I mean, that was our idea as well, to have the information packets. In terms of the blood donation kits, they do have a shelf life. And so they've been reluctant to have them just as a stock item. The idea, though, would be that you could have a couple of them as a stock item if somebody decided at the last minute. Here, let me pass these around.
I had another question about private cord blood banking that people do. I teach prenatal classes, And there are a lot of people in my classes that are all hysterical, and, they want to bank their base cord blood, or the amount you're talking about is really expensive. So I'm wondering, how did they even, what would they use that blood for? The child eventually develop leukemia, they can't use the blood.
That's correct.
So, I don't understand.
Many of us don't understand.
Okay.
Therein lies the fallacy of the thought of doing this private cord blood.
Yeah, so those private cord blood banks are making a lot of money
They're making a lot of money.
off of minority parents.
So once it goes into a private bank, they can no longer be taken out, like, used for
No.
COVID at all?
No, it's just used for the family that
Private.
donates.
Your
If they
family.
give permission, like, elsewhere.
Well, I don't think
No,
that's
the people that are
idea.
saving it want it for them.
Want it for themselves.
You know what I mean?
You know.
Yeah.
I think of it as like another insurance policy.
But I think that the idea of the donation, again, you bring up the real problems with this whole thing is number one, educating pregnant women and families. Two, to understand why public donation really is going to benefit them. Getting far more samples into the pool that can be used versus private. And there's no expense. And I think the interesting thing too is they are so careful at screening. And I think in a way it's because of the daunting part of it. She's halfway through it and she's got a big frown on her face. I mean, I think really it would almost take almost a volunteer to sit down with somebody. But then if it's sensitive information, do you want to volunteer knowing of them? Oh, it's a good question.
I have a question. How come whenever we hear about stem cells, it's always about the embryo, we never hear about this stuff?
Well, that's because it probably is more glitzy. And I think that's why this is a very, you're right, we don't hear enough of this. Absolutely right. Maybe the Institute for Transfusion needs to do more advertising.
How closely is ours race those?
I think that with any blood product, you try and get as close as you can to reduce the amount of risk of rejection. Going back to getting the minority sample, you would be a great place as a source for minority donations. But yours be willing to sell that concept to the. And so one of the places we started is actually with the nurse midwives because they have such good rapport with their patients. But even though they counseling, actually, I think very few have actually taken advantage. Very few patients have actually taken advantage of this. But I'm hoping that during this next year, this is something we can really focus on. Yeah.
How much of the minority function is basic mistrust?
I can't say. It could be missed. The applicants may seem drawn to them.
Do people here understand the Tuskegee syphilis tests and how minority populations feel terribly, and I think
Right. That's a very good point. That's a very good point. I don't know. But I think that somehow the message has to get across that maybe their child someday might need a transfusion. Or the blood your baby, from the port, of another African American baby or a lady or, Pacific Islander baby.
What is the funding from the private bank on customers?
Well, it is a grant from this Institute for Transfusion Medicine. And it's kind of a little unclear to me, but they may have gotten some of that money from the institutes that goes to them, and then they are helping with the logistics of each bank.
They need to do some TV advertisement and their numbers would like dramatically increase because most people are not personnel.
No. And quite frankly, unless we evolved with the law, I wouldn't have heard about it. And I consider that we kind of keep up with everything. But you also have to look that the program in the United States is relatively new. The first cord blood transfusion 5 years ago still. In Europe, like I said, they were back in the 1970s. And I don't know I really don't know what kind of clout the private thing, whether there is something in here keeping kind of advertising them go to the public or not. Could be. Well, is there any more questions?
I don't understand what justice law is supposed to be.
Haven't you
I haven't
read it?
been approached. I'm just about 35 weeks, and this is what I should.
And policy in the law is it doesn't say every healthcare provider shall. If you look at the HIV law, the HIV law, every healthcare provider shall engage about the importance of getting an HIV test. But the way the law is written is every hospital shall.
So does this mean when I go to the
I bet
deliver?
they may or may not, they should, but I wonder how many people, how many hospitals are really doing it. It's one of the, we brought it to attention when we found it. But like I said, I think the law has some flaws in it. It's your provider, rather than hospital.
Especially if you have to order this 6 weeks in advance.
Absolutely. Because this is not a slam dunk, there's not questions to fill out, there's the testing. The family has to be extremely motivated to follow through everything. And to be really motivated, you really have to be educated as to why this is important. It's in the deal.
Ever the case where you miss out the initiative to say I want to donate $600?
Sure. Absolutely right. I mean, it means they have to take the kit.
Man.
In your little suitcase, you have your kit with districts. What do I do? And, what they're going to put else, all this.
Then you can't even donate. Right.
Right. I mean, you give that to your provider so that that's not easy. Carding, then people are.
Thank you, Louise. And again, the nursing continuing education unit should complete the evaluation form and hand it in to Kathy or Peggy at on your way. Thank you.